Hello, everybody. We're just waiting for more attendees to come into the Zoom room. There's oh goodness, there's over 200 of you here already, but people are still coming in. So let's give it another 3 or 4 minutes to give people time to come in, and then we'll start. Can I remind people that the tech should do it for you? But just in case the tech forgets, could you please switch off your microphones and would you please switch off your cameras? And so can everybody please make sure that their cameras and their microphones are switched off? Thank you. Can everybody please make sure that their microphones and their cameras are switched off? Okay, and welcome everybody to Ubele's broadcast, where we're going to spend the next 2.5–3 hours kind of exploring what's going on in terms of COVID-19 and the BAME community across the UK. I think it was kind of on the last day of the year last year that the Chinese announced that there was a problem with a virus. And since that day, the world has gone crazy. Since that day, it's felt as if we're kind of living in a movie. I certainly feel as if I'm living in a movie. And then about 6 weeks after that, we started hearing noises from nurses, we started hearing noises from doctors, we started hearing noises suggesting that Black and ethnic minority people were getting this infection at a rate much, much higher than other members of the community. And that wagon really has brought us to where we are today. I'd like to invite our first 2 panelists for today, Yvonne Field from Ubele and Patrick Vernon from absolutely everywhere in the world to come and join me. And first of all, to introduce yourselves very briefly, and then we'll find out about why you thought it was important for today to happen. Patrick.
So good evening, everyone. It's really important that we have this event. And I think according to Ubele and the organisers, this is probably one of the biggest community events online to explore the issue of COVID and the impacts on BME communities. I have various roles. I've been involved in the Windrush scandal. I've worked for the Centre for Ageing Better as Associate Director, and we're doing a lot of work as an organisation around ageing and the impact of COVID. I also have been working closely with the team at Ubele as well. And also recently I've been appointed to chair the healthcare investigation board, which looks at untoward incidents in hospitals. And I think the organisation will be probably in the future looking at major reviews of hospitals and COVID as part of its work. So the reason why I've been involved with this is three main reasons. Firstly, what's quite clear, and in terms of COVID-19 and its disproportionate impact on Black and minority communities in Britain, not just in the community, but particularly those frontline staff working in the NHS, social care, transport, retail, are getting the brunt of this. And in many ways, I do a lot of stuff around cultural history, and you almost have to compare it to the First World War. In the First World War, if you were serving in the West Indies Regiment and other regiments of colour, you didn't have any guns to defend yourself during the First World War. And it feels like that's what's happening now with COVID-19. There's no community testing, there's no community tracing, there is no, the PPE for frontline staff is wanting. And more importantly, the disproportionate impact of COVID-19 exposes the inequalities and structural inequalities and discrimination in society. And it's only been the last 10 days or so that race has been put back on the agenda at a national level. And that's why I think this event is really important. But more important, it's about a community response. We've heard responses from a whole range of academics, public health specialists, and a whole range of thinkers on this, but what's the community response? And I think this event is important. Second reason, on a personal level, a family member of mine has died of COVID-19, and that has an impact on my family. So we're living and breathing COVID-19 in terms of bereavement, the whole trauma, and still we can't believe that this has happened to us. But I know that this has happened to families up and down the countries. Again, disproportionate affecting BME families, has an impact on how we grieve, has an impact on how we bury our loved ones. And again, working with Ubele, we've launched the Majonzi Fund, which means in Swahili means grief or deep sorrow, because we know that we want to celebrate and acknowledge the lives of our loved ones after the lockdown as well.
Thanks very much, Patrick. We have so many panelists, so many guests to get through today. Yvonne, tell us, why did Ubele get involved in this? You need to unmute. Yvonne? Oh. She's looking a bit lost. Patrick, something...
Good evening, everyone. I'm really going to apologise before I start. Hello, good evening, everyone. Can you hear me?
Yes. Yes, we can.
Can you hear me?
Yes. Yes, we can hear you.
I get the impression her computer's gone.
I get the impression her computer's gone as well. Technology.
You need to kind of ad-lib whilst Yvonne's ready.
Yes, yeah. Something I kind of wanted to a little bit of ad-lib with you, Patrick, because we decided to have this event 10 days ago.
Yes.
And we got a team of young people together to kind of make it happen, of younger people than us, to kind of make it happen. And something that I've kind of really noticed in kind of watching that team and watching the way that they work is today I sent out a message to them saying that you people, you bat so way above your weight. And part of the reason that they've been able to do that, I think, is the leadership that you and Yvonne has shown them, and your refusal to kind of put limits on what it was that they could achieve in such an amount of time. And, you know, they achieved an amazing feat of 800 people online, streaming on ITN. Some really, really good guests to come and talk about this. And I think that one of the things that Ubele, when Ubele was started, one of the concerns of the group of people that were involved in its beginnings, and certainly one of the concerns of Yvonne Field, who started Ubele, was the lack of leadership in our community. What do you think about the leadership in our community around this particular issue? Do you feel that there is something else that's needed?
That is an interesting question. It's a vexed question that we've been looking at for many years. I can remember during the height of the Windrush scandal, that was the same question that was raised. Where is the leadership? It was a question that was raised during the riots. Any major incident on Grenfell. And, you know, I think the work, what we need to do and moving forward, and particularly key actions that's coming out of tonight, is about, we need to have a dialogue where all of us, different ages, different lived experiences, different worldviews come together collectively to demand social justice. Justice means on different levels. It's for frontline staff, for those families who've lost loved ones. And the theme of this event is about, we want answers, but also we want to make solutions as well. And I think, you know, the power of networking, the power of the collective of leadership is really critical. Everyone's waiting for this Messiah to arrive to take us to the promised land of fighting for justice. But we're all activists, and I'm sure there are many activists online tonight who have ideas, have perspectives, who want to make a difference. And I think it's how we collect and bind that collective energy of activism and leadership to answer those questions. But more importantly, to hold the government to account. And more importantly, we need to hold ourselves to account also.
Mm. And what do we hold ourselves account to?
Well, it means it counts on different levels. I mean, I think that on a basic level, it's about how do we mobilize ourselves and the community to make sure that we are dealing with some of the key issues affecting the community as we speak right now. And I think you'll hear from a whole range of speakers tonight about their perspective, covering issues from food, domestic violence, accountability, etc., etc. And I think there's also about holding look at issues around what is the health system doing, and local governments doing, mainstream organisations doing, as well as national and central government as well. And also, I think one of the things, I'm sure Yvonne will talk about this, because she's launched a petition which I'm supporting, is that we need to have transparency and accountability. And for the record, I actually spoke with Trevor Phillips today, who, as you know, was reported in the media that he was leading a review. I'm sure Kevin Fenton will talk about this in detail when he does his presentation. I spoke to Trevor, and Trevor says he's not leading a review. He's got a tech company, and they're providing solutions to Public Health England around looking at the data and analysing the data. And Kevin, I'm sure, will talk about this in much detail.
That's really good to know. Yeah,
but the point is that in a period of this pandemic, people want to have clarity, clear communication, information, and then they can see the follow through. And I think that's our work tonight to do that. Okay,
well, I'm going to move Patrick to kind of one of our elected leaders, because we have the Deputy Mayor of London online, Debbie Weeks-Bernard. And Debbie Weeks-Bernard is one of the deputy mayors in London. And are you there, Debbie?
Yes, I am here. I don't think you can see me though, unfortunately.
No, I'm going to ask you to start your video. There we are. Have I asked you to start your video? Have I asked
yes,
somebody?
You have.
There you are. Hello, how are you doing?
I'm fine, I'm fine. And thank you for inviting me to be part of this amazing event.
Thanks for coming along. Debbie, I was looking, I had a look on the GLA webpage to kind of learn something about you, because everybody's heard of Sadiq Khan, yeah? And people don't know Debbie Weeks-Bernard, do they? They just kind of know Sadiq Khan, and they don't know that you're kind of, you're in there somewhere doing something. And then I saw, Debbie, this amazing title that you've got. Yeah? Debbie Weeks-Bernard, Deputy Mayor for Social Integration, Social Mobility and Community Engagement.
Yeah,
That's a great title, isn't it?
It's a bit of a mouthful, isn't it?
It's a bit of a mouthful.
I need to shorten it, don't
I? It's a lot of work, isn't it?
It is indeed. And unfortunately, I am not an elected official.
Oh, you're not an elected official?
No, I work for an elected official.
So you work for an elected official.
Yes,
you work for an elected official. And so you were brought up in London?
Yes, I was brought up in London.
In which part of London?
I was brought up in Brent. Both my parents are still there in Harlesden.
Right. Okay, so you were brought up in Brent and your parents are still there. Yep. And to get this incredible title, you must have fought really hard and worked really hard.
I have worked quite hard, yes, for a very long time. But I do know quite a few of the names and a couple of the faces on your amazing lineup today.
Oh, right. Okay.
Yeah, so this is I feel like I'm in illustrious company this evening.
Thank you very much. So Debbie, I wanted to ask you, what did you want to do with that title?
Well, obviously, I wanted to change the world, Michael.
You wanted to change the world?
Obviously, absolutely.
Any particular bits of it?
Well, all the bits which are about inequalities for minority ethnic groups, but all people who are really not experiencing London as equally as they should be. So my title is incredibly long because it's about tackling inequality, facing up to discrimination, making sure that everyone has an equal chance to have an equally positive experience of London, which we know that for the most part, not everyone is having. So my job is about tackling those sorts of issues.
Wow. And so, Debbie, we are faced with the most amazing picture of inequality with COVID-19. We are faced with people from the Black and ethnic minorities communities being at risk of dying and all of what that means. And so, as the person that worked really hard to get this amazing title because she wanted to change the world, and in changing the world, what she wanted to do was to change inequalities, I wonder if you can tell us, how does that relate to the COVID-19 situation? And how does your wanting to change the world, how can you use your position to impact on what's happening now?
Well, I think the first thing to say is just well done for doing this, Ubele, Michael, Yvonne, Patrick. I think one of the issues that is really important about this is that we know that there is emerging evidence that COVID-19 is having a disproportionate impact on people from minority ethnic backgrounds. And we, as people of colour, who are from the communities who are experiencing this inequity, need to be at the forefront of determining how to tackle the issue. And that's why I think it's so important that you've got all of these illustrious names on this amazing screen that I'm sitting in front of, because it's very rare that we have the opportunity to do something which is community-led or led by people of colour. And so what you're doing this evening is incredibly important. It's a really good march against tackling this issue and making sure that the voices of communities, but indeed the sector, the third sector, which is the sector that I came from before I went to work for Sadiq, that the sector is at the vanguard of doing this.
Okay, so I can see that we're doing some grand stuff.
Yeah.
And we really are very, very proud of ourselves for having done it. And yeah, I don't mind owning that. I'm going to own that. We really are pleased that we managed to kind of get our shoes off, take our gloves off and to get something done. My question, Debbie, as the woman with this illustrious title, in this illustrious position, who worked hard to get yourself to that position because you wanted to change the world, what can we expect of you? What can we expect to be seeing you doing? And how can you be using your position to ensure that we get, that our community gets the best of what it can get and what it deserves?
Okay, well, the first thing is that COVID-19 has been exacerbating issues that people were experiencing prior to it turning up. So there were people who were experiencing a variety of different forms of inequality before COVID-19 came. And I greatly believe that it is those experiences of inequality which are contributing to the impact that it is having on minority ethnic communities. And so what that means is that we need to look at some of those social determinants which we know drive health inequalities, and to continue to do important work in addressing those social determinants. So for example, we know, for example, that there are people who have continued to go out to work and put themselves at risk. And those are individuals who are on some of the most insecure types of jobs and roles, earning often very variable amounts of pay. And we also know that disproportionately those individuals come from minority ethnic backgrounds.
I'm going to come back
and
at you again,
sorry.
You know I'm going to come back at you again.
Okay.
Because
so this is leading to the next bit.
We've got Drew. Drew's listening, and Drew's a graphic harvester. And what Drew is going to draw all evening, is Drew is going to draw the actual things. If you said to me, what is Debbie Weeks going to do as of tomorrow about this problem? That's what Drew's going to draw. Tell me something that you are going to do as of tomorrow that I can chase you on and make sure that you've done it.
Okay, some of the things that I'm going to do tomorrow I've already started doing. So the first thing that we need is better data.
Right.
So I've spoken with my boss, Sadiq Khan, and I impressed upon him the need to write that article that he wrote for The Observer a couple of weekends ago. We do not have a recording of ethnicity on death certificates at the moment, and it is something that people in the sector have been calling for. So we will continue to call for that from the NHS. It's important that we have that data. We are also at City Hall engaged in a drive to get better data. I know you've got Kevin Fenton, who will be speaking after me, and that the PHE are leading a review which will involve the collection of data, but we need London-based data because we have some of the highest numbers of people, both from minority ethnic backgrounds here, but also the highest numbers of people.
And so one of the things that you're going to do is that you're going to do your damnedest to ensure that proper data is collected so that we know exactly what's happening. One of the things I know that we're calling for at Ubele, Debbie, is that there should be an independent public inquiry into this. And the reason that we were calling for an independent public inquiry, I think, was for the reasons that you spoke about when you started speaking. And you said that this is impinged on by the context in which Black and ethnic minority people live in London all of the time. And what this is doing is this is just kind of stirring it up and making it and putting it in our support that call.
Sorry, I couldn't hear what you just said.
I just said, are you in a position to support that call for an independent public inquiry into COVID-19?
For minority ethnic groups in particular, or just generally?
Minority ethnic groups. Yeah.
I think we do need a review. We do need a review, and we need something that stands outside of
public inquiry. The thing that we're calling for is an independent public inquiry, because our fear is that a review could be so specific, so narrow, so tied, that actually it doesn't do all of the things that you said needed to be done at the beginning of this, which is a kind of root and branch look at the conditions under which BAME people live in the United Kingdom.
Yeah, no, absolutely. And if this is something that you're thinking of doing, and I know that you guys will do it perfectly well, can I make an ask of you in addition to that? I think that there have been some bits of work that have been done before that could be helpful. So the Marmot review into health inequalities in the UK, is incredibly important to something which is looking at a public health crisis, which is impacting on minority ethnic groups. So looking at existing stuff that's already out there, but also to just continue to involve community voice, because whilst it's important for us to have seen, and I don't know, I'm sure everybody who's on this call saw when those pictures started to emerge of people of colour who were dying from the disease, it's important that we have voices to go along with those images, because the images and the data, what they do is they stoke up fear and anxiety in communities, and we can't just have data on its own, because we need to have some actions to go along with it. So whilst I've said that one of the things that I'm doing is calling for better data, another thing that I am calling for is to ensure that we are both involving community voices in the solutions that we come up with, but also that we're working with the sector like yourselves to help to send out that message of reassurance to communities who will see this stuff and say, well, it's impacting on me. What can I do to keep myself and my family and my community safe? So we need the sector to lead the response or the reassuring message to those groups.
Thank you very much for coming. Thank you very much for joining in the kind of conversation so openly. We will be chasing you, we will be begging you, we will be pulling all of that knowledge you have out of your head and kind of finding ways of getting it into the community and making it active and being a kind of activist force. So thank you very much, Deborah Weeks Bernard, with the very long title, for coming to join us.
Very welcome.
Thank you. Is it possible that we could ever so quickly go back to Yvonne Field if her internet is ready? If not, we'll go to the second panel. Yvonne, are you able to hear us?
I can.
Oh, you can hear us now, can you?
Oh gosh.
Have you sorted it out?
Yeah, I don't know what happened. I think this has been the worst internet connection I've had for the last 4 weeks. I don't know if Virgin is targeting me. I could get into conspiracy theories, but I won't.
Yes,
I won't.
Okay, Yvonne, so why did Ubele decide that this needed to happen?
Well, first of all, can I just welcome everyone? I know, Michael, you're the host, but I'm looking at 348 participants online, and I've also been reading some of the comments, and we sent this call out nationally. So I'm really pleased to see in terms of comments, people from the Northwest, from all over the country, and you're really welcome to this conversation. So thank you. Oh, represented Scotland as well. Someone said Scotland. Wow. Welcome, Connie from Scotland. So why did we decide to do this? In terms of the event or in terms of the work we've been doing, Michael? In
terms of the event.
So, I mean, linking to what Debbie just said about community voice, we became increasingly aware over the last few weeks that, you know, the stories of what's happening with clinicians and within individual families and within the community as a whole was sort of being surfaced, but we weren't actually hearing from communities directly that were being affected directly. So we thought that we would create this webinar, and we've never done anything like this before, so we're learning as we go along. But we thought we'd create this space really for dialogue with key members of the community involved in all aspects of life, from health and employment and other areas, and that we were and that we just wanted to really host a conversation where we mobilize people. And I mean, I'm really pleased, as I said, about everyone who's joined us today, and that we could actually try and come up with some actions that we could potentially take forward. One of the things that I've realized is that, you know, when I started Ubele, well, effectively 10 years ago, but we registered about 6 years ago, there was something for me that was driving me about a lack of a strategic plan. What's the vision for our communities? And I started with working with the African diaspora, although we work with other minority communities as well. But I was clear that, you know, the plan our parents had in the Windrush generation didn't quite work out in terms of going home, and that we needed a plan B to ensure that we were strong communities here going forward.
Okay. In terms of going forward, what we're going to do now is actually we're going to hear from Dr. Kevin Fenton. And Dr. Kevin Fenton has been, I've got a slide, and Dr. Kevin Fenton is on the NHS executive, and he's been collecting data and looking at this problem. And immediately after a 2-minute, we're going to have a 2-minute comfort break, because I'm told that we need comfort breaks. We're going to have a 2-minute comfort break, and then we're going to come back and we're going to hear from Kevin Fenton, followed by a small panel who are going to discuss some of the work that Dr. Kevin Fenton's been doing. So give us 2 minutes for a comfort break, and we'll be back with Dr. Kevin Fenton. Hello and welcome back. The next person that we're going to meet today is Dr. Kevin Fenton. Kevin, are you here?
Yes, I am, Michael. Hi.
Hello. Can you, should I have your video?
Yes, absolutely. Yeah. That's fine.
The problem with me, Kevin, is I can undo your video, but as soon as I go to touch it,
yeah,
it opens somebody else's video instead. It's like the thing keeps moving. And
okay.
So there, how are you doing?
Good, very well, thank you, very well.
Thank you very, very much for being here. I know how busy you are, and I know how busy this situation must have made you on top of your already busy life.
Well, thank you for having me on today. It was really important for me to be here with you. Mm-hmm. And you are right, I do have other meetings to go on to because of we're in the middle of the emergency response, but it was so important for me to be a part of this discussion tonight. hear from community members about what's really, some of the key issues that they're seeing in their communities, but also as we start the work in Public Health England to ensure that you're cited on that work and have a chance to give me any thoughts you may have on the direction of travel.
Right, okay. Kevin, so first of all, tell us what responsibility you have in your professional role for this, and then tell us what you've been finding.
Great, okay, so I actually started as the new Regional Director of Public Health for London. So I am the head of Public Health England's London office, the regional office in London. I'm also the Regional Director of Public Health for NHS London. So I'm the NHS's Public Health Director in London. And as part of my role, I'm also the Statutory Health Advisor to the Mayor of London. So like Debbie Wicks-Bernard, I also work with Sadiq Khan, and that's a key part of my role, working with City Hall and providing advice on both COVID as well as other major health issues affecting the city. Prior to this, some of you may remember, I was one of the executive directors in Southwark Council. I was the Director of Public Health there for 3 years, and before that I was a National Director with Public Health England. So my role, Michael, is helping the response to COVID in London. And this involves ensuring that we have a robust health sector response, but also working with a range of partners to ensure that we're coordinating effectively to end COVID. And this includes coordinating testing for COVID in the city, so working with partners to ensure that that's being delivered. We're now preparing to offer contact tracing at scale across the country as part of the removal of restrictions, the lockdown restrictions. So that's going to be a key intervention that we put in place. We're also preparing for antibody testing in a few weeks' time, hopefully, and that is tests that will confirm whether or not you've been exposed to COVID and may have some level of immunity, although that remains to be seen. And then ultimately, when a vaccine becomes available, to think about how we implement the vaccine, etc. So my role is about supporting the public health response to COVID in the city, but also working closely with my colleagues working nationally as well. I think you're on mute, Michael.
Thanks. Wait, Kevin, and so the young people who we had organized this thing, yeah, have kind of pulled out 2 people who are really up there playing with the big boys and girls, sorting this mess out. Kevin, in terms of the BAME community, what is it you've been finding? And what's the next most important thing that you think needs to happen in that community?
So that's a great question. So the review that I've been asked to do by the Chief Medical Officer and the Chief Exec of Public Health England is to oversee PHE's research on the impact of COVID on Black and minority ethnic communities in the United Kingdom. And specifically in England, but working with the devolved administrations to understand the impact in those nations as well. Now, PHE has been looking at the epidemiological research. We're looking at the risk factors associated with the uptake of testing. So is there differential impact across the minority groups of testing? Is there a differential impact on who gets diagnosed with COVID across the racial and ethnic groups? Is there a differential impact of minorities across minorities in who gets severe disease? And of course, as you've heard from the previous speaker, is there a differential across racial and ethnic groups in death or mortality from COVID? That work is now underway, and we're expecting the results of that to be available by the end of May. And the reason it will take longer than, well, it will take as long as it will need to, because we want to do a thorough analysis. But because we don't have routine data collected on many of these clinical parameters, it means that we need to be doing a lot of data linking and matching in order to understand and to capture the ethnicity data. Now, in addition to the research, there is a component of community engagement, which I have already begun, which began last week, in which I'm hosting a series of community engagement and listening sessions with different constituencies to both hear what they're hearing and what they're seeing in local communities, but also to help us to think through what are the issues so that when the results of the study become available, we can work together to talk about how we disseminate those findings, how we engage communities on those findings, but most importantly, how we change what we're doing given we know better, given the better knowledge that we have. So over the next 2 weeks, I'll be meeting with academic partners, local government partners, directors of public health across the country. I'll be meeting with devolved administrations. I have a cross-government group that we're pulling together to hear from people working across different government departments on this issue, listening, challenging, and preparing for the analyses that are going to come.
And so when are you hoping to publish this? How long do you think this review is going to?
Yeah, so we're expecting the results to be available at the end of May. And what we'll be looking at are, as I mentioned, do we see ethnic variations in the various clinical stages with COVID? And can those variations be explained by other factors? Right. So for example, Michael, we know that age is a key determinant of the severity of disease. We know that being a male gender, if you're a male, you tend to have a worse outcome than if you're female. We don't know why. We know if you've had chronic kidney disease, chronic heart disease, a history of diabetes, or are obese, you're likely to have a worse outcome with COVID. And we also know if you're a smoker, you're more likely to have a worse outcome as well. So these factors may well explain some of the differences we're seeing across ethnic groups, but it may not. And we need to think about that.
Right. And so, Kevin, by the end of May, you're kind of hoping to report, and I can see that there is an absolute necessity to look at what the here and right now is telling us so that we can respond to the here and right now immediately and perhaps save lives. Yes? And so I can see the real need for that. At Ubele, and this is a question I'm asking all of our panelists, really just because we need to check that the things that we're asking for are the right things to ask for, and that we shouldn't be in a different place asking for something else. But one of the things that we're asking for is that we're asking for an independent public inquiry into COVID-19 and the BAME community. And we're asking for that because we think, as well as there being the kind of medical determinants that you've been speaking about, that there might actually be something about the context in which these people live, and part of that context is racism. And so our guess is that a much broader look it won't do the short-term stuff that actually you need to do right now because we need to save people's lives, but long-term, that there needs to be a kind of root and branch look at what has been happening. Is that something that you think would be a good thing to be doing, or do you think it would be something that would take away? I don't know. What do you think?
So, Claudia, I'm a civil servant, so I can't call for a public inquiry, but I can say that there are different perspectives that I think you're rightly hitting the nail on the head about. First, COVID didn't create inequalities, right? These inequalities are long-standing, they're pervasive, and they're persistent. And COVID simply came in and made those inequalities stark. Second, you're absolutely right that we're dealing with the epidemic in the here and now. But in the post-epidemic phase, as we face social and economic disruption, the burden of that is going to be felt hardest among those of us who have the least. And so whether we're looking at the past and how it informs the current or present, or we begin thinking about the future and who's going to be disproportionately affected, I think having a broader look at those social and structural determinants will be incredibly important. So whether it's done through a commission, through further academic research, whether it's done through community engagement, we must use, I think, this moment of COVID, not only to reflect on the response, but to ask ourselves, how do we do things differently moving forward? And how do we ensure that as we're rebuilding our society, we do so through a lens of equity, a lens of social justice, a lens that says, what are the things we need to do differently to protect those who have the least among us? Or those who need to be engaged, for all of us to benefit from that.
Kevin, I'm just going to ask you one other question. Just before I do, there's a panel who have been listening to you who are going to join in our conversation. And so I'd ask some technician type person who's got their fingers on some buttons to let that panel now into the room. Kevin, I know that you have some strong connections with Jamaica, and that COVID have an impact on Jamaica. I wonder if you could tell us what's going on there right now.
So I have been tracking the epidemic quite a bit, obviously, because I have strong connections there, but also because it's really important to understand how different countries, especially in the developing world, are responding to the outbreak. And I'm really pleased to say that the Jamaican government has had a very proactive response to this. From the first identification of cases, many of whom actually traveled from the UK to Jamaica and were visiting family and relatives in Jamaica, to ensuring that there've been strong public education activities. They began their lockdown and their curfews very early relative to the phase of the epidemic. They've been very good at shielding older people, of which I have key relatives in that group, and continuing that conversation with the public about what does the society do to protect themselves against COVID, introducing face coverings, introducing social distancing very early on. So the government took a very proactive, I think, stance to dealing with this. But again, for those of you who know Jamaica, it's an island of many inequalities. And your ability to take up social distancing, your ability to isolate at home is very strongly determined by your social and economic status. The more wealthy you are, the more able you are to lock yourself away with a freezer full of food. If you're not economically able to, that becomes a lot harder. And I think that has been one of the big challenges in Jamaica, where we know that there's quite a bit of social and economic disadvantage on the island.
Thank you very much, Kevin. I'm just going to go to Barbara Gray. Now, Barbara Gray is Mayoress of Lewisham, which is one of the London boroughs for people out there who aren't from London that might not know. And so, Barbara, are you there, Barbara? I know that she's in the room. Hello, Barbara? No, okay. In which case, let me go to D Woods. Okay, well, while they play technical stuff, there is somebody I can actually see. I can see Kunle. Sorry, Kunle, I know you weren't expecting to come on right now. Ah, here we are, Joy. Hello, Joy.
Hi, how are you?
I was just about to replace you with Kunle.
Oh, you can do that anytime. It's a good replacement.
Hi, Joy.
Hi.
Joy, you were listening to Kevin Fenton. Tell me, what did it mean to you listening to that?
Well, I think you asked a really pertinent question about issues of structural inequality and whether that would be part of the data collection process. And you mentioned discrimination, which I think it's interesting. I was at a wellbeing board thing in Birmingham last week online. And it's interesting we can talk about this issue, but without talking about the discrimination that Black, Asian and other minority ethnic people face. So I think it's useful to broaden that scope, to think about discriminatory factors and to not just play against some of the kind of known data collection sets, which may not give us a more a deeper answer really to the kind of things that are really happening to Black and minority ethnic communities. And I don't think you can forget about Marmouth. You know, 2010 was the first report, and many of the communities that we work with in Birmingham are in exactly the same place, if worse. You know, the life expectancy hasn't improved, health data hasn't improved. So really, we're failing. You know, this country is failing many communities, not just Black and Asian minority ethnic communities, but many communities too.
First action, Joy, what would you say is the first thing that should be done to begin to reverse that trend?
I think we need to look at what we've done to improve the life chances of very discriminated against communities. We do some kind of usual things, and collecting the evidence tends to be something we're always in pursuit of. And in this case, I know the evidence is important, but many organisations we work with, they say, oh, we can't do anything because we haven't got the data. But actually, sometimes having the data or not having the data doesn't lead them to do anything differently with our communities. I think that people have spoken about working with people rather than top-down solutions. I think we need to listen to people's experiences and recognise what the impact of some of the things that we're doing, because quite often the impact is not the impact that people really experience. And I don't think we can forget issues of economics. I mean, we've done a survey. We haven't quite closed our survey yet, but the thing that we're gaining from the participants that have responded so far is their fear about the future. So if you felt the future was bad before this, I mean, what is it going to be like now? And what is it going to be like, especially for Black and Asian and minority ethnic communities who experience discrimination, who can be in lower paid jobs, who do suffer from the structural inequalities that we're talking about? I don't know how we're going to get out of this, but it feels like our rate of progress has been poor. The interventions we've used have been non-effective. So what's the big leap that we need to take to get this better?
Dr. Fenton, I don't know the exact numbers here, and I know that you're a person that might know the exact numbers. But I know that in Lewisham, where I live, that the life expectancy difference between the people that live in the poorer parts of the borough and the richer parts of the borough is almost 7 years. And so somebody in a richer part of Lewisham can expect to live 7 years longer than somebody else in the poorer part. I mean, and sometimes we forget when we talk about inequalities that actually we're talking about the quality of people's lives and the length of people's lives.
That's right, Michael. And we shouldn't forget that it seems like such a long time ago. I think it was in January or February, but Michael Marmot's review, 10 years on from his first report on inequalities, was published. And as Joy has said, that really confirmed that actually for the last 10 years, on the back of economic austerity, that in a lot of areas, we had gone backwards or had not progressed as fast as we had hoped. So in Southwark, where I worked, the differences between the richest and the poorest was in the 10-year gap between the richest and the poorest. And then when you began to look at ethnic minorities versus others, then you began to see even more stark differences. We saw tremendous differences in the uptake of clinical services, whether it is bowel cancer screening, breast cancer screening, cervical cancer screening, things that we know save lives. And those are also economically patterned and differ across racial and ethnic groups. So I agree with Joy, we're not coming into this with a blank sheet of paper. We're coming into this with a rich historical understanding of what's driving inequalities. We're coming into this with lived experiences, all of us, with the realities of whether it's discrimination or poverty or stigma or whatever forms of inequity we experience on a day-to-day basis. But the question and the challenge to us is, how do we use this as a moment in time, as we're resetting everything else in society, to begin to reset where we are and how we engage at the table on these issues to really make that difference. And I think that is, the data, the review that PHE is doing must be a small part of what is required to be done to get us to another place. Please do not think that this review on its own is going to change the world. It is going to provide the evidence to allow us to go further and faster, I hope.
Right. if you don't mind staying with us just for a little bit longer, I just want to, Dee, are you there?
Yes, I am.
Could you switch your camera on, Dee, so we can see you?
It is on.
Oh, is it? Oh, okay, because I'm looking at a picture of you looking towards the sky.
Well, my camera is on. So.
Your camera is on. Okay, Dee, talk to us about, because you work a lot with food, don't you? Tell us what you do.
Yes, I do. And, you know, that is the other crisis that has been happening over the last 10 years, affected by both the social inequalities, but also the no recourse for public funds, right? So when the lowest fifth of the population in terms of income, right, our communities have been experiencing household food insecurity. And in the most recent YouGov poll, it shows that we're almost twice as likely to be experiencing food insecurity. Can't hear you, Michael, you're muted.
What's food insecurity?
Meaning you don't have enough to eat, or you're skipping meals, missing meals. And, you know, people, racially marginalized groups are experiencing very high food insecurity.
So something that really surprised me at the beginning of this was when they were talking about schools closing. There was a real fear about children that were not going to receive their school dinners, because their school dinners in a lot of cases was their main meal of the day.
Yes, and a lot of, you know, children from, you know, racialized minority groups already missing out on those free school meals, right? Because of no recourse to public funds, because their parents might be, or single parent might be working and not actually meet the criteria. Sometimes, you know, they're just over the limit by a couple pounds. So what we're seeing, I run an organization, Granville Community Kitchen, which is on front lines. We're seeing a lot of families, especially large families, you know, needing food parcels. All right, we're doing probably 300, you know, people.
Wow.
And that's just in a small part of Brent.
I know that over in Tottenham, in North London, that a group of people have actually have got together, and that they've got together in order that they can send culturally appropriate food to people. Is that something that's happening all over London?
It isn't, and it is in fact a big issue, particularly amongst homeless people who have been temporarily housed, amongst elderly people who are medically isolating. They are not getting their culturally appropriate food. You're not getting halal food. So, you know, how you expect to have a strong immune system if you're not eating properly and you're eating food from, you know, the industrialized food system surplus, right? Highly processed foods.
Industrial food system surplus. I don't understand what you mean.
So the entire food aid, charitable food aid world runs on surplus food that comes from the supermarkets, that comes from what we call big food. So all the major companies. And most of this food isn't really food, right? It is not our culturally appropriate food. It isn't nutritious food, but this is the types of food that majority of food aid projects get and have to redistribute. Even the government's, you know, parcels that went to the medically isolated people was not good. Right? It consisted of squash, sugar, egg noodles, and, you know, foods that aren't good for health, basically.
Wow. How important is food to health? Is that a really obvious question, Dr. Fenton? Is that Your switch is switched off.
I'm sorry. It's fundamental. It's fundamental. If you can't eat, as Deidre has said, then you cannot. It's if you don't have a home over your head, if you don't have someone to take care of you or to be connected to, if you don't have food to eat, these are basic necessities of life. And the fact that so many of us in our communities are struggling with food insecurity or food poverty in the 21st century, I think is something that should cause all of us as citizens to look inwards to say, how can we do better? How can we do better for all of us as a society? And I think, again, if you think of in some boroughs, nearly 20% of residents were food insecure. In other words, they were likely to go hungry at some stage in the day because they had to skip meals. Then in the environment where after this epidemic has peaked and passed, and we think about jobs which have been lost, people who have been furloughed, lives that have been disrupted, then we're going to be thinking of even worse food insecurity, people living on the poverty line, and that affecting their health negatively. Also remember that during this period of lockdown, we're dealing with challenges for mental health, challenges for physical health, domestic violence is increasing. So there's a range of things that we're going through now, which we're also going to have to pick up the pieces on. And finally, one of the things for all of your listeners, people who should be going into hospital now for care are staying away. In part, that may be because they may be afraid of becoming infected with COVID, or, and especially a very Caribbean thing I know, where we think we don't want to bother the doctor. We don't bother the nurse. So we'll stay home and not worry about the chest pain that we're having or the shortness of breath. And so we're seeing people dying either at home or by the time they get to hospital when they should have presented earlier. So that is going to add to a lot of the inequalities that we see moving forward. So, you know, again, COVID didn't cause all of this. A lot of this happened before, but the situation that we're under now can make it worse if we're not mindful and if we're not acting deliberately to prevent it from having a really negative impact.
Thank you very much. Thank you very much for being with us today, Dr. Fenton. It's been really revealing. We will be calling on you again and again and again and again and again. But thank you very, very much. I know that you're a busy man. If you can stay for the rest of the time, stay with us, please. And if you've got to rush to Town Hall, to Parliament, to somewhere, to Jamaica, you go and do your thing. But thank you very, very much for being here.
Again, and colleagues, really great to hear your panelists. I do have to go because I have another conference call to join. But it's been a real pleasure joining you. And let's continue the conversation, especially as and when the results from PHE are available. I'd be happy to come back to discuss them as well.
That would be amazing. Thank you. Thank you.
You're good. Bye-bye.
Bye. Hey, we have Marion. Where have you gone, Marion? You were just here. And oh, there you are. You were on the left of my screen and now you've gone to the right. How are you?
I'm very well. And I'm sorry I've just missed Kevin. And good evening, everybody.
Could you speak closer to your microphone? You sound as if you're far away from your mic. Yeah.
Can you hear me now?
I can do, yes.
Right. Hi. Great to join everybody. And thank you to Ubele for hosting this. Apologies. We seem to have a conspiracy in North London where the internet keeps cutting out. I'm not too far away from Yvonne. So we've missed the last 10 minutes of the discussion.
Right, okay. Well, Marion, you run the NAS project. Yeah, and NAS project is probably one of the largest community projects in London. Tell us a little bit about the NAS project and tell us a little bit about what you do there.
So I have the pleasure of running NAS. NAS is a sexual health agency. It's been running for 29 years.
Wow.
It was started because of Nazir, who was HIV positive and died from AIDS. And when he found out he was HIV positive, he went to get some support, but the support wasn't culturally specific. So many people could understand the fact that he was a closeted gay man and he had AIDS and he was going to die. They didn't understand that as a Muslim, he wanted to die a Muslim, or the impact of what him being gay would do to his family or his community. So the late gay rights activist Shivanda Khan set up Naz in his memory.
Mm-hmm.
And we work across 4 key areas, really. One is around sexual health prevention and how we tackle that culturally within our communities.
Mm-hmm.
There are many approaches, but we believe that the people that are impacted the most should be responsible for leading the delivery of services and the design of services.
The people who are, say that again, the people who
are disproportionately impacted by health inequality should be leading on that. So NAS predominantly looks at HIV, sexual health and reproductive health. And the inequalities across BME communities in those areas are well marked and well documented. And I'm sorry that I'd missed Professor Kevin Benton earlier. Kevin's done a lot of work around ensuring that there is a genuine community voice in this space, but we continue to be disproportionately impacted decades after the fact. And I'll come on and speak about that a bit later. The second thing,
can I ask you a question? I just want to go back on what you were saying, because what you were saying really interests me. The idea that those people who are most affected by a situation should be involved in leading the change to change that situation. I'd like you to talk about that maybe in relation to COVID-19 and what it is you want to see the Black and ethnic minority community doing to create a change around the health inequalities we find ourselves with at the moment.
Okay, so I'm a firm believer that not only should we be part of the response, oftentimes, especially in terms of delivery, BME-led agencies, community groups will be engaged by larger charities to do delivery work to reach the people. But I believe the sum total of our ambition is more than delivery and operations. We need to be involved with the strategy, the research, the thinking, and the leadership early on in the debate. And I think one of the things that everybody has said unanimously is around making sure that there is a strong BME response. And for me, that looks like holding different stakeholders, key stakeholders to account. So we've been involved with an initiative along with Ubele and Yvonne that has written to a number of stakeholders, including Public Health England, saying that actually, while we need more data, Public Health England has perhaps some of the best surveillance in the world. We know what the inequalities look like in sexual health. We know what they look like in cardiovascular. We know what they look like in mental health. What we need is an action plan that joins it all up and puts it on the radar of the key players. So the NHS need to have a strategic plan for BME communities. The Department of Health needs to have a strategic plan. The Cabinet Office need a strategic plan. I think part of the challenge is this siloed working or trying to say, well, you're not organized and I think the fury and what I'm seeing in my own community and for myself, I'm so angry, I'm so disgusted that people have been working behind the scenes till very late at night and early in the morning, making sure that we hold people to account. And I think exercising that agency at this moment in time is actually critical. I've seen people on the chat saying, what can we do? Well, there's a number of initiatives. It's not just the work that Ubele are doing, and Ubele are doing an amazing job. You've got the work that Charities So White are doing. You've got the work that the core group are doing. You've got the work that Naz is doing, and there'll be others that we don't know about. What I'd love to see coming off of this call as an action is us sharing what people are actually doing and amplifying that across different leadership structures. So I hope that answers your question.
It does just about. Thank you very, very much. Is there one thing one message that you wanted to make sure that everybody got from you before you go?
Yeah, I think this is the time to do something. There is this resistance to kind of wait until next week. Let's not wait until next week. We don't have to be 100% articulate because actually nobody knows the answer. I do think it's an opportunity for everybody to reframe this. We've spoken about this from COVID. I want to just drop another idea. For those that are a certain age, and I'm nearly 50 years old, right? We are British citizens. If you had said that British citizens, a certain percentage of British citizens were more likely to die because of their ethnicity, there would be an outrage. It's time that we stop being second-class citizens. It's time that we exercised agency, write one letter, we can write it together, but there must be this joining up of voices that says this is unacceptable across the piece. And it's not just with the government, it's with a range of stakeholders. This is unacceptable. You need to be brought to account. And if I may just leave you with one very simple thing. We wrote a letter to Public Health England. They have a really good resource leading the debate, but their chief executive wasn't on there. We need to make sure this is on the agenda of every single chief executive that has responsibility across health, across housing, across children, across everything. We need to apply the pressure. We need to be consistent. We need to roll up our sleeves and be in it for the long term.
Thank you. Thank you very much, Marion. Thank you. Susan, are you here? I can see your screen. I can see you smile, so you are here. It's not just a photograph of you. How are you doing?
I'm fine, thank you.
I understand you're stuck in Spain, Susan.
Yes,
Yes?
got locked down.
You got locked out of London. You got locked out of England.
Yeah, but it doesn't stop me from doing a lot of things that we're doing now.
And how long have you been stuck?
Oh, about 4 weeks now.
About 4 weeks. Okay. Susan, I understand you've got a particular story to tell around COVID-19 and around what's happening in your community. Where would you like to begin telling that story?
Yeah, so I am one of the trustees of Kanlungan Filipino Consortium, which is an organization of grassroots organizations, and it's being run mainly by volunteers. And one of the things that since the COVID-19 hit the country, we started to realize how many Filipino health workers and migrant workers are being a victim, being infected, and also dying in the communities. I think there's a health service journal analysis of the deaths in the NHS a few days ago that came out. And they're saying that of the 106 confirmed deaths of COVID among health workers, 20% of that are Filipino health workers. And of the nurses that have died, which is about 30 plus, a third of that, more than 30% of that are Filipino nurses. So we're being hit very badly by the COVID pandemic. And I can understand why that is the case, because many of our healthcare work, many of our migrants community members are working in the health and NHS in the care sector. And many of those, and unfortunately, many of the families I've spoken to whose family members died have told us that the family members died because they didn't have any PPEs when they worked, whether in the NHS or in the care homes that they work in. So it's really, really glaring kind of hit into our community. In addition to that, we also have a section of our community who are what we call people with no recourse to public funds, which was alluded to by one of the speakers earlier, but also a lot of undocumented migrants who come here to the UK with documents, but then in the process of the government changing immigration rules, they lose their right to stay and to work in the UK. And therefore they're staying and working in the UK now without documentation. So many of these people also are dying. I mean, we've got a few members of the community who are undocumented, died, but not even managed to get health service and will not go to health services because they're afraid that they will be reported to the Home Office. And that's one of the whole kind of effect of the whole hostile environment that the UK government have done in the last 5 to 10 years in the UK of really terrorizing migrants, refugees, asylum seekers, that they don't have the right in this country to access any kind of benefits or any kind of health services. And if they do, then there'll be data shared to the authorities, to the Home Office, and it will result to them being reported out of the country. Now, the government would say, well,
so what you're saying, Susan, is you're saying that we have large numbers of people in this country, yeah, who are probably the people doing the face-to-face work with people who are infected, yeah, who are washing the sheets, the blankets, who are going to people's houses and looking after them if they're old, and that those people, because they have no recourse to public funds, can't stop working because there is nothing to feed them if they stop working. They can't be furloughed because the people who employed them can't declare them, and that they're dying.
Yes, very unfortunately, that's the case. I mean, a lot of them are carers and looking after elderly and vulnerable people, but then they cannot afford to be ill. But then when they get ill, of course, they have nothing because they have no access to government services, no access to public funds. And they're also fearful, as what one of the colleagues said earlier. They don't want to go to the hospital. They don't want to present themselves because they've always been terrorized by this government, which says that they are undocumented or no recourse to public funds. Therefore, they don't have the right to seek for services that's available to hopefully normal people. And I think that's, I think that is a criminal act by the government against these people, because these people are working and they're not relying to any government services. They've worked all their lives in the UK, caring for people, looking after elderly people and vulnerable people. And at this point in time, because they're most vulnerable, nobody even managed to count them. Nobody even know their kind of circumstances, the kind of overcrowding situations that they have. They haven't got jobs because the jobs, they can just be kicked out of their jobs, and they don't have rights in terms of job security in their work. So they are being pushed to the wall and really being pushed to a point or a breaking point. I was talking to a family today who told me that they're a couple with a child who has this very severe autism, and that they don't even have money now to feed into the meter for their gas and electricity, because they have lost their jobs 4 weeks ago or 6 weeks ago, whenever the lockdown happened, and they're only living on the food that our organization is giving them, providing them.
Thank you very much. Thanks for sharing that with us, Susan, because I think sometimes and it's difficult with this particular situation, but sometimes when we start talking about a situation, particularly something that's happening on such a large scale, we forget that there are kind of individual stories in there of individual people who are losing their lives, whose children are having to get used to being without their parents, without their mum, without their brothers, without their sisters. And so thank you for sharing that story with us. It seems like a good place perhaps to take a comfort break. After the comfort break, we're going to be back with a panel with Carl Murray, who's also from Ubele. And Carl has been doing some research into the impact of the lockdown and COVID-19 on Black and ethnic minority organisations, mainly in London, but actually across England. So why don't we take a comfort break for 5 minutes and come back with Carl. Hello, Mr. McMillan, sir.
Am I able to talk, Michael?
Hello, Carl, are you hearing me? Hello?
Yes, I can hear you.
You can hear me. Okay, let's go live with Carl Murray.
Okay. I'm going to share my screen because I think it will be a lot easier if I do so.
Okay.
Okay, we're on.
All right. And so, Carl, you've been doing some research into the impact of COVID-19 on the BAME community organisations.
I have been, yes.
Yeah, just before you start telling us about that, Carl, just something for the people who are our audience. I can see that there are lots and lots of comments being made and lots of questions being asked. We are going to start picking up some of those comments and some of those questions at the end of Carl's presentation now. So please keep them coming. I'm sorry we haven't used them up until now, but we will start doing so in a few moments. Carl, tell us about what you found in the research that you've been doing.
Thank you, Michael. Well, just to very quick intro or context, in the light of the concerns that we have heard already so far, about 3 weeks ago, Ubele decided, working with a number of people, that there was insufficient information on the ground. We were hearing stories, but we did not have a handle. There was no official data, and there were no confirmatory information circulating, and we didn't know where to go. So we decided that maybe it would be a useful exercise if we started to trawl and ask those within our network what the situation was. As a result of that, we put together 2 waves of surveys that went out widely, not just in London, but right across the UK, where we had connections and where people had further connections. So I saw some comments on the chat line commenting about London-centric approaches and data needing to be more UK-wide. We tried, and so this is a very quick snapshot of some of the outcome of that exercise. The fuller report is due out towards the end of this week, and so we will let that put that out with further. That will contain further information that we were able to trawl. So 2 phases that we undertook between the 19th and the 23rd of March, which was just before the official lockdown announcement, and then we followed that up between the 27th of March and the 4th of April to see what difference was beginning to materialize. And over those 2 waves, we had 182 responses from respondents across the UK. And what we did was, in wave 2, some of those organizations that had responded to wave 1 to some of the same questions, we took them out. And so we then found 165 what we call unique organizations. That was, they weren't doubling up, they were a single organization. So so we had 165 different organizations that responded. And of that 165, 83% of 137 were BME-led organizations. And I'll say a little bit about what determined BME. And what that was that organizations that were led by 51% or more of their management committee trustees, we deem that as community-led. So that was the criteria we used. We received responses from 7 regions across England, the majority coming from London. Some of the key headlines then, the size of the organizations, when we tried to identify the size of the organization by their income band, and we used the National Council for Voluntary Organizations criteria to try and help us to get a sense, and also for comparison reasons, when the NCVO produces their report, we could then match up. And any organization that was receiving less than £10,000 a year and or under 100,000, we lumped as either micro or small organizations. And from the chart, you could see that 54% fell under the micro, less than 10,000 a year income, and 33% were the small organizations, and much smaller were medium organizations. When we also looked at the reserves that those organizations held, we found that 68% of the micro and small organization combined had no reserves that would last them more than a month. Small organizations that had some reserves that could last them up to 3 months, about 19%. Very few of the small organizations, if any, saw themselves having a reserve beyond 3 months. And so the 1 or 2 medium organizations you could see had income up to 6 months. So in total, what we were finding is that when we asked the question, what's your reach in terms of connections? And we found that of those 37 organizations, between 15,000 to 20,000 clients or beneficiaries, they were reaching per week, which tells us that if you were to extrapolate that beyond just those and across the country, you're actually talking about quite a lot of clients not being served were they to go under. So bottom line was we found that close on 9 out of 10 of those BME organizations could cease to operate over the next 3 months if the crisis was to continue and get deeper. And this is largely due to having no or little reserves. And those organizations most affected would be the micro and small organizations as indicated. There, more than half of those who responded knew of someone, a colleague, who had that at the time. If you recall, this is between the 19th of March and up to the 4th of April in broad terms, and that's right at the outset, I'd known someone with COVID-19 and or were themselves self-isolating as a result. It was about 63% then, almost 6 out of 10. Many of the organizations that responded, especially to wave 2, started to develop new ways of working. And we've already heard commentary about some of the beneficiaries who would lose out as a result of issues. But also, people are also making comments about some of their fears and concerns with regards to things like domestic violence and mental health brought about in terms of isolation, and particularly concern about young people. What we did in the last 24 hours was to take a look, an experimental look at this issue of the NHS doctors and support workers. And if I may, Michael, this is brand new, so we wouldn't have had a chance.
Can I hold you there, Carl? Okay. Can I hold you there? Because I think that what you have told us 1 or 2 things which are so important that I think we should stop and we should reflect on those things with a larger group. So could I ask you to stop sharing now? And perhaps I can bring Kunle in. Kunle.
Good evening. Hi.
How are you doing, sir?
I'm fine. I've been intrigued by the debate and the discussion. It's been very useful.
Okay, Kunle, you run an organisation called Voice for Change.
Yeah.
Yeah. Voice for Change does what, Kunle?
We are an infrastructure body, membership-based, spread all over England, of around about 460 organisations. Our job is to help with capacity building with those organisations and also act as an interface between policymakers at every level.
Okay, so from what I've heard of what Carl has just reported, that we are currently in a place where 9 out of 10 Black and ethnic minority organisations do not have reserves to carry them more than 3 months, that we're now in our 2nd month, aren't we, of lockdown?
Yeah.
And if the situation continues, those very organisations that we need to be strong at this moment, who have been working with communities, who know communities, who are perhaps your membership, are about to fall and die. Where does that leave us? What is the impact of that?
The majority of our organizations and members are small and are consistent with, I think, the data that Carl referred to, and also NCVO's data, which is that we have a lot of community organizations and charities that have a turnover of less than probably 15,000 a year, probably about 60%. Mm-hmm. And then you look above that line and you'll see that we have organizations with turnover of maybe under 100,000, but still are in a situation where, as has been expressed by the data, they wouldn't be able to exist longer than a month on their current reserves. Mm-hmm. I think earlier on, when the doctor, Kevin, was talking, he made a point about how COVID had actually brought to the surface some of those very real relationships to funding and to resources that BAME communities exist under. And I think this is another example of that.
What are we going to do in the immediate, this day from tomorrow? What is it that we have got to be doing as a community to shore up the organisations that are the backbone of our community? What is it that we need to be doing?
I think in the first instance, we need to be able to research those streams of money that are available for emergency funding. One of the things that West for Change has been doing has been looking at those streams. And what we're finding is, once again, BAME communities are underrepresented in receiving those funds. So we've been doing work with the National Emergency Trust. That's the people who put on the Big Night In last week. And basically they're saying it's the same story, a lack of engagement with BAME communities. And here you've got an emergency committee, which has got resources that our people are not connecting into. So last Thursday, they made on that one night, 27 million. That was match funded by central government with another 27 million. So, 54 million in one evening.
So there's 54 million.
We have made sure that our groups that are in trouble are accessing that resource.
So it's 54. So let's just take that figure of 54 million pounds. Yes. Let's take it that we accept Carl's findings that we have 9 out of 10 Black and ethnic minority organisations, community organisations that are really in trouble and could disappear in a month's time.
Yeah.
How do we ensure, Kunle? Because the other thing that has come out of our discussion earlier on was the importance that the impacted communities lead their own defence in some way, that the Black community actually gets on board and actually starts doing what needs to be done ourselves. But the resource is somewhere else. Kunle, how do we get the resource to those organisations? What do we need to be doing to get the resource to those organisations tomorrow?
Well, in response to your question, tomorrow basically means you have to streamline your approaches. You have to target, and you can't, for example, be having a 20-page application process and 3 months of kind of evaluation before you make a decision. You have to be able to turn things around literally sometimes in 48 hours. And so the people that I'm talking about are capable of doing that. What they've failed to do is to connect with our communities. So that means also at the same time developing a critique of those relationships and why that exists. Is it simply that those organizations are racist and have no interest in BAME communities? Or is it that on our side, we fail to actually do the groundwork and make that connection. So we're an umbrella organization, Voice for Change, and we have to make sure that those connections are made. That's our job.
Okay, Hannah.
Hi, Hannah.
How are you doing?
All right, very well, thanks. Thank you so
You're from
much.
an organisation called Charities, So Why? I'm intrigued by the name, and I was going to come to it first, but I'm not now because I understand that the dilemma that you work with as a charity, as an organisation, is the dilemma that Kunle was just describing. That there's lots of resource somewhere, yeah? But that resource isn't getting to the Black and ethnic minority communities. And what I understand is that you've come up with a kind of solution to that problem. What's your solution to that problem?
I wouldn't call it a solution. I think that's a bit far. So I think it might be helpful to provide some context. And thank you, Carl, and thank you, Kunle, who have both been excellent partners in this so far. We're a grassroots organisation of people who work within the charity sector who came together after an incident last year where Citizens Advice, the big national charity, put together some training for their volunteers, and they had one page on engaging with BAME communities, and the title of the page was called Barriers We Find in BAME Communities, and there were 9 points there, and I'll pick out a couple. So one of them was an intrinsically cash-centric culture. Now, what does that mean? Why are you telling your volunteers that? The second one that was on there was a cultural focus on honour and shame. Again, who are these people? Why they focus on honour and shame? Thirdly, one of the other 9, I think is particularly interesting, was a distrust of specifically British authorities. Now, the idea that a national charity like Citizens Advice is sending out training like that, or was sending out training like that, to its volunteers shows how disconnected national charities can be from our people. And the problem is, as we know from the excellent talks we've had so far, is that coronavirus has actually brought this into sharp relief. It's like the problems we had with Grenfell, but on a national scale. So what we've been doing since then is we've been working to organise within the sector. So that means finding people who work within the sector and asking them to have the conversation in their workplaces about how and why civil society organisations can produce materials like this. And it was the start of a long conversation that we've had that has shown that, to be honest, structural racism exists and is reproduced throughout the sector.
And I'd like you to come on to what your demand is, because I know that you have a very specific demand.
Absolutely. So we had that conversation, and now we've moved on to working on COVID-19, and we've produced a paper. It's called Racial Injustice in the COVID-19 Response, and it's updated every single week with all the co-determinants and lots of key principles. Please take a read. But the first thing we did is write a letter to trusts and foundations, to the funding sector, and ask for 2 specific things. The first one was to look at who is on and who is having oversight of where money is being handed out. So if you have a working group of people looking to hand out funds, then there should be 2 people of, and this is a number we picked because we thought it was fair, of BAME origin who are on that group and who importantly have power within that group to help steer the direction of funds. Secondly, we've been looking at ring fencing. So we've put a call out to say that we think 20% of all this emergency cash, so the money from the National Emergencies Trust, for example, that Kane was talking about, should be sent specifically to BAME-led organisations, because as we know from Carl's research and your research, it's those organisations that are 1, at the front line of the response, and 2, that after we leave this, and people have mentioned recovery slightly, we know it's BAME people who will be in trouble when there's a recession and people lose their jobs, when housing is poor, when health is poor. And if those community organizations aren't there to support people, we'll be worse off, not now, but in the recovery as well.
So what is the advantage, Henna, of this kind of bracketing of 20%, say?
So we've used this as a starting point. We're not experts at this. We're a grassroots campaigning organisation. We've used this as a starting point because we know that we're the grassroots people who can take the fight to the sector and say, look, we know there's a problem. Here is one answer to the problem. What are you going to do for us? And we know that traditionally we've talked about trusts and foundations and power within the sector and resources, that people have not prioritized BAME-led groups in the way that resources are handed out. This would be one way that we can make sure resources can get to where they're most needed. Now, I'm not saying it's an incredibly detailed and carefully thought through idea, but it's an idea that helps respond to the urgency of what we see, which is that 9 out of 10 of these organizations could close.
Yeah. I think that you kind of remind me of, and I'm just kind of showing how old I am now, but I think it was in the 90s or the 80s and 90s, there was quite a lot of bracketing of money for particular communities. And what actually that meant was that meant that the organizations responsible for sharing that money took a bigger responsibility for making contact with those organizations, for making contact with those communities. And because the need to live with the bracket meant that they had to be much more active in trying to meet the needs of that community. And so I can see exactly what it is you're talking about. Carl Murray, sorry, just go back to you, Carl. Are you hearing me, Carl?
I am.
Yeah. And so I've heard from Kunle, I've heard from Henna, that actually to kind of respond to the research, the response to the research that you've done is to get money out to those groups. Is that the response that's needed? Yeah,
I mean that's what we're driving forward, along with Charities So White, and I think and Kunle, and I think what we do need is a concerted effort at different levels, and trying to, in a way, support what is needed. Where there's lack in certain areas, we could lend our support in that area to try and build the picture. And I think it's a danger if we ever think that one body, one organization can do it all. What we can do is to lend our support and voices. And I think on the question of unlocking, especially emergency response funding at this moment in time, and especially in particular for those small and micro organizations that are struggling and are also doing a good job on the ground, is that we need to start to educate the masses, those who are in the know, as well as those who are considering to apply, that we've got an opportunity, and we're trying to crunch the numbers. And in a debate like this, the numbers can only be holistic. And I could see some people would like some further disaggregation, but that will come. But at this moment in time, we've got to try and tell the story. So yeah, so the aim is, can we unlock some of that resources for the community? And can we hear the community's voice in that need? And that's what we're trying to do.
How do we get the community, how do we get the people who are doing that work talking to power? How Kunle, sorry, let me come back to you from Voice for Change. How do we get the people who are doing the real work on the ground, making a difference in the communities and estates and all over the country? How do we get them a voice so that they are able to talk directly to power?
Well, you've got to work at it. Work hard. At this moment, I think I agree with Carl. There is a moment here to transform some of the relationships that Black organizations have with the rest of the infrastructure, particularly in charities. So I think what Charities So White are doing has been great. I think the stuff that we've been doing at Voice for Change we've been there for years, pushing, trying to get into these spaces. And I think some of the recognition that, particularly with the number of deaths, those that were at the press conference that Keir Starmer gave the other day with Doreen Lawrence, to hear that 119 health staff from BAME backgrounds had actually died. It was revealing, and the proportions of BAME staff within the health service that are dying, the numbers in nursing homes that we're not hearing that are dying is frightening. So we have to use those levers and that pressure to begin to get in those spaces where resources are being allocated. And I have to say that we held a webinar last Friday with NET and with the UK Communities Foundation. And as a result of that, we put pressure on them to open up to us. And in fact, they are now forming a new Equalities working group as of today. And they're also looking for people, leaders like Henna, to come on to that equality working group to look at that relationship that I've talked about, but also more importantly, how to influence the distribution of those resources and funds.
Thank you. Thank you very much, Kunle. Thank you very much, Henna. Thank you very much, Carl. I'm going to go to Barbara Gray. Hello, Barbara.
Hello, is my voice on? Hello, everyone.
Your voice is on.
Great.
I see you on your grand chair with SE6 written up above you. a true Lewisham woman. And the mayoress of Lewisham, I understand.
I am until the end of the month, so I've got 2 days.
And so we can get you now as the mayoress of Lewisham till the end of the month.
Yes.
Congratulations for having been the mayoress of Lewisham, Barbara. Barbara, what's going on in Lewisham? What's going on in Lewisham? What are people doing about COVID-19? What's happening on the ground? What is your office?
Right. Well, I mean, it's difficult to know what's going on the ground because it just seems like everybody has disappeared. So we don't know where the politicians are or the councillors. Everybody has just gone quiet. So nobody really knows what's going on or hearing from them. And if you were to go on the Lewisham website, you'd have absolutely no clue. So as in the usual way that I work, I tend to get my information from people just contacting me and saying what's going on. So everything that we've talked about, and the Marmont report seems to be the one thing that the council officers take notice of, is around all the wider determinants of health. So in Lewisham, all of this is really paramount because meeting up last year with the Race Disparity Unit, and they produced some profiles for us. And what it showed that Lewisham had the 3rd largest Caribbean population in the country, second to Croydon, and first was Birmingham. So, of course, when I saw really early on that Birmingham had the highest concentration of a city of people who were tested positive with COVID, I straight away sent an email to the mayor saying, oh, so what does this mean for us in Lewisham? We've got a very similar population. And I get a message back saying, oh, we're going to discuss it at the Gold meeting. So there's a panel that meets every morning, officers only, I've been told, to discuss it. And then who knows what happens. So, but from people's own personal experience, you get intelligence because we've got people who are working in the hospitals, and somebody was, really shocked because they were saying, King's College Hospital is just full of black men. And that was quite early on, which kind of made you start to think, well, what was going on? And then, you just knew people around you who were starting to feel ill, with heavy colds and things. And just 2 doors down from me, a woman, her husband died. It was taken out of home and died of COVID. And another woman I know who her sister died, and she was probably in her 50s, and her nephew died 2 weeks later. So we just know instinctively, just from what we're seeing and hearing, that it's impacting on us. And then I was able to look at the data to show that definitely it was black men that was impacting on, as young as 40 years old. And whoever was collecting that data, and it was about people, it was a snapshot of people in intensive care. So this is a national study. and what it was showing was that people with a high BMI were the ones that were really being affected. And not necessarily the people that were obese, that they were on there, but people with a slightly high BMI, they seem to be the highest in terms of the people who were getting that. And Black women were more likely to get pneumonia. So when I looked at all of that data straight away, I wrote to send an email saying, oh, so what's going on in Lewisham? Are we collecting this data? Because I'd heard this thing about data not being collected, ethnicity data on deaths. And I thought, surely they must have done something about it by now. But listening to Debbie, it sounds as though they haven't. So there's a massive silence, and I keep emailing and keep not getting anything back. Barbara,
what you're saying, hang on. What you're saying is that you are the mayoress of Lewisham.
Yeah.
That Lewisham has the third largest BAME population in the country. That we know that the BAME population are being massively affected by COVID-19. That there is a gold meeting every morning in Lewisham, and that the gold meeting haven't come up with a plan on how they're going to deal with this situation, particularly as it relates to the BAME community.
Well, I don't know. I haven't been told that there is one. When I ask, I get no reply. So that usually means that there isn't anything that they either want to tell me or that they're not doing anything. The one thing they have done, which they've said, is that they've made a connection with Birmingham. Because, as I said, Birmingham has got the first largest Caribbean population. So I get to say, we need to link up with Birmingham and let's see how we can work more widely rather than Lewisham on its own with just 2,000 staff trying to resolve the problem, and also with Croydon. So this was last summer. So now they've connected with the Director of Public Health in Birmingham, but who knows what that's going to be, because it is very much about the officers doing it. I don't see where the community have got a voice. And even myself, I keep on thinking, I'm listening to today and thinking, what's the one thing I'm going to do? I'm going to ask to be, to attend one of those meetings, to be at least the community voice and to advise in my role as BAME Health and Equalities Advisor for Lewisham. So I think that just needs to happen to actually physically be in that room. But I keep sending messages and emails about all the things I hear about. One woman said to me that she lives locally and she couldn't bury her husband. Nobody could attend the funeral. And I thought, well, that's a bit kind of strange. And I attended a big session like this with faith and community organisations, and you should have at least 10 people who could attend. So I am still not clear about why it is that this woman felt that nobody could attend that funeral, a Black family, and she's burying her husband in Southwark. So there's little things and things around young people. So it's been all right, but I think they're saying that, you know, there was some incident last week and they're just worried now about reprisals, so it all may kick off because there's just no police around. And the young people definitely want to come out. And I went for a walk about this kind of time, duskish. And this is when they come out. You see them walking along the streets down in Lewisham and going in the park. And I just think, wow, you know, what's going to happen here? So it feels as though we don't quite know what's going to happen because of the population that we have here. We've got the largest Black population of any authority. That's just what the Race Disparity Unit has told.
Barbara, can I make a suggestion on your behalf? I'm sorry.
Yeah.
But what I'd like is for absolutely everybody on this call that comes from Lewisham to send email tomorrow, to send an email tonight to the mayor asking them what support the borough is giving to Black and ethnic minority people who are affected by the COVID-19. Yeah, I think that's the least that people can do today, and that maybe there needs to be a coming together of people in Lewisham, because if your mayoress can't get an answer, then who can? Thank you very, very much for being here tonight, Barbara. Thank you. Thank you, Henna. Thank you, Kunle, and thank you, Carl. Elizabeth, hello. Have you got your microphone on? I think I can hear you. No, I still can't hear you. I think it's a local problem to do with your computer, Elizabeth, because according to my screen here, your microphone is actually, no, your microphone doesn't exist. According to my screen, it's not plugged in or something. Let me see if there's anything I can do from here. No? Okay, I'm just gonna go very quickly then back to Carl while Elizabeth sorts out the problem with her sound. Carl, are you there?
I am.
Yeah, and so Carl, if there were there's money, which is one thing clearly that people need right now. If you could think of two other things or one other thing that it was urgent to do right now, this minute, what would it be?
I think one of the things we need to, as organizations go, I think we need to really start thinking about the service we're providing and how we're providing it. Mm-hmm. and the resources that's going to be required for that, not just in the short term, but mm-hmm. medium to long term. And if there are opportunities now, then I would strongly suggest and recommend, and I know they're probably doing it already anyway for survival purposes, mm-hmm. is to try and lock in as best as they can. I know in some areas, especially local authorities in particular, and I've seen somebody make mention of it, there tends to be a principle of historical funding. Mm-hmm. It's either unwritten, but it's certainly most people in an authority will recognize it, whereby a lot of the established organizations tend to be the ones that get funded. Mm-hmm. And I think there needs to be a challenge to that. And I think one of the challenges you could put forward is the better use of data to help identify the need. And I think a lot of small organizations don't have the capacity. Mm-hmm. And a lot of organizations fail to recognize, not just a small one, fail to recognize that data in this day and age, not just because of COVID-19, but generally anyway, speaks volume. And if we don't engage with our clients, we don't identify them, we don't speak to them and find out what's going on, we are putting ourselves at a disadvantage when it comes to speaking about the needs and what we want. So we need richer, more robust, and robust here is not about you having large data set. It's about having a data set based on your clients. Mm-hmm. I think that's the best way of putting it.
Thank you very much, Carl. Elizabeth's sorting out the problems with her sound, but I know that we have Joy. Joy, are you here?
Yeah.
Yeah, and I understand you're leaving.
I am actually.
You are? Okay. Well, Joy, let me just say thank you very much for the contributions that you made earlier on. And I'm sure that Ubele, you will have to continue connecting, continue to make sure that we're working together to create change. Thank you very, very much, Joy.
No, it's been a great pleasure, and congratulations for putting this together. It's I can see how much hard work it's gone, and it's been great to just read some of the chat. Actually, there's lots of information and questions that need to be answered. Can I just say one thing though before I go?
One very, very quick thing.
I think that we sell ourselves short if we don't think about using the representation more broadly. We have councillors that represent us, we have public organisations that represent, we need to demand much more, and you know, we are well served by lots of the smaller grassroots organisations, but we shouldn't forget that we're entitled to everything, absolutely everything, and we should really punch higher.
Thank you very much, Joy. Elizabeth, I got a thumbs up from you. Is that because you're now working?
Well, of a fashion, I am.
Goodness, it sounds like you're...
I'm working through one of the Ubele staff who have very kindly called me, and I'm speaking to you via my phone through her phone.
Oh, wow, that's magic. That's magic. Elizabeth, we heard from Barbara about, sorry, Elizabeth, tell us what you do. Tell us the organisation you represent.
I work for the National Church Institutions, which commonly is the civil service of the Church of England. That's the easiest way to think of it.
The civil service of the Church of England?
Yeah, it's the administrative body, and so, you know, it's got all of the departments that one would expect in a sort of institutional bureaucratic organisation. It operates very similar to the civil service in some way.
Okay, and what's your role there?
Sorry?
What's your role?
So I am the national advisor, so for the country. What we call, once again, one of those dreadful titles, minority ethnic Anglican concerns.
So you're the Church's national advisor on minority ethnic concerns?
Correct.
Thank you. And how has the Church been responding to COVID-19? And how has the Church been responding to COVID-19, particularly in relation to the Black and ethnic minority communities?
So, you know, I mean, the Church of England has 42 dioceses around the country. So each diocese leads, as it were, and operates for that particular diocesan area. And so there's lots of things going on at parish level, where you know, food banks have opened up, supporting that way, in supporting local communities. What are we doing on the national stage? Well, on the national stage, you know, you do have bishops in the House of Lords.
Mm-hmm.
The Church is in some ways connected with government. So there's discussions with government, of various government departments around all of the issues of COVID, including including race disparity. What are we wanting to do or planning to do? Hoping to arrange with Ubele and Patrick is a round table at national level, where we will have community organisations, the leading community organisations who are like Cunley, like Charities So White, obviously Ubele and others, where we can sit round the table, as it were, via Zoom, and discuss what the Church could be doing short term, medium term, and long term. And I'm talking about race disparity here. I'm not talking about the wider issues. The focus is race disparity and let's be clear, race inequality.
We heard from Barbara, and we've kind of I've been invited to online funerals, and people having to kind of bury their folk differently at the moment. What is that meaning to the BAME communities?
Wow. Well, you know what? One can only put oneself in that place. What do I know is actually online now and participating in here. An email, we were supposed to be meeting on Friday and couldn't because one of his long-serving parishioners, a black female Caribbean, I think of Caribbean heritage, died as a result of COVID. And so he sent an apology email. He obviously couldn't attend because that was, you know, that was obviously more pressing. What does it mean? It means that, and I think somebody mentioned this earlier about numbers going to funerals. I think it isn't any secret that Caribbean funerals tend to be rather large in comparison, let's say, to a wider population. And the idea that you cannot even say goodbye, the idea that you cannot give a proper, in inverted commas, send-off, the idea that you cannot be there, that you cannot see and be a part of those last rites is absolutely devastating.
Because I know that in the Caribbean, that we have that we would spend, if somebody dies, everybody turns up at that person's house. We hang around, we have 9 nights, people get together, people stay together as part of the process of grief. And if people are unable to grieve in the ways that they would normally be able to grieve, what does that mean, do you think?
Well, look, in the short term, it means what I've already said, but what we don't know is what it means in the long term. I'll give you an example of this, and I am going to refer to Gypsy Traveller Roma communities here. So a member of the Roma community, a traveller community in Kent, died as a result of COVID. 120 people showed up for that funeral. The police were called. The priest was trying to police the numbers unsuccessfully. The police were called. There was tension. There was social tension. There was reaction. And sadly, later that night, one of the young men who, very much like Caribbean communities, there is the before gathering and the after the funeral gathering. One of the young men was killed. The circumstances are difficult, but anyway, a young man was killed as a result of that. But 120 people showed up. The police were called, and of course, there was massive tension.
Okay, thank you very much for battling with the technology and finally getting through to us. I'm going to move.
Can I just say something, Michael?
You can do, yes.
I mean, I'm not going to repeat what everybody has said. I very much agree with much of what has been said this evening. And I think what I definitely would want to add, in terms of the public inquiry that you are calling for, which I absolutely support and will be encouraging further support on that, I would really like to see, along with that public inquiry, some sort of commission. I think you talked about an advisory group, but some sort of commission who will have the authority to hold the public sector and any other sector to account. So we have had public inquiries in the past. The Stephen Lawrence inquiry was a public inquiry, and look at where we find ourselves today. And I think somebody mentioned it earlier. It's about what changes as a result of a public inquiry, and unless that public inquiry happens and there is a body holding to account for the recommendations being implemented, it'll be just another public inquiry. And then finally, I'd just like to say to everybody, this is a Kairos moment. And this Kairos moment means this is the time now for us to really mobilise, to be self-determining about where we go and what needs to happen as a result, and to help make that happen. And if we don't do that now, we have lost that moment. That's all.
Thank you. Thank you very much, Elizabeth. Patrick Vernon, are you there, Patrick? Patrick or Yvonne Field from Ubele? I actually just kind of wanted to touch base with them because as we talked about bereavement and we talked about death and we talked about people's inability at the moment to have proper memorials for their family members who died, I know that Patrick and Yvonne have together launched a fund to deal with exactly that. I wonder if one of you wants to tell me something about it.
Okay, shall I have a start and then Patrick can join in? So just over a week ago, we launched the Majonzi Fund, Majonzi, Majonzi, Majonzi Fund, taken from Swahili to mean grief or deep sorrow. And as Elizabeth and Michael, you've been talking about rituals and the lack of ability to do the things that we'd normally do culturally, religiously, in order to bury our dead. We know that in 6 months or a year's time, there's going to be need for memorials. People are going to want to get together and to remember those that have passed during this pandemic. So the fund, which was just launched last week, as I said, on GoFundMe, and the details will come up on the slides, it's on GoFundMe, aims to ask for donations for both memorials and also for counselling support, therapeutic support, because we know the mental health and well-being of our community is going to be impacted probably for generations to come, and I'm not exaggerating. And as we know, after Grenfell, in the aftermath of Grenfell, we have a lot of therapists and clinicians from our communities, respective communities, that weren't unable to provide support because a lot of the large charities and trusts that do counselling and therapy that are not necessarily culturally appropriate, they parachuted into Westminster and were able to get these contracts to do this work, and that a lot of our therapists and clinicians were not able to do this work. So the fund will also pay for therapy and counselling support, as well as memorial support for our community. And we really want people to get behind this, because we will look for some public funding to support it, but we also want a huge level of donations, because we want to make the counselling and therapy free for members of our community, but we need to pay the counsellors and therapists to provide the service. Patrick, you say something about the Auntie platform that it will be on.
No, we're not going to talk about that right now.
Okay.
What we're going to do is that we're going to go to Patrick, and we're going to ask Patrick to just make a comment on the fund that you've started.
Okay, fine.
Then we're going to go to the final comfort break, and then we're going to come back to our penultimate panel. So Patrick.
Yeah, sure. So it's really good that we've still got high level of participation in this event so far. I mean, the fund in many ways is quite important. I mean, I said before, I've lost a family member, and we're going through that whole process of grieving and sorting out burial arrangements. And there are thousands of BAME families from different faith communities up and down the country going through the same experience as well. And also there's work colleagues, people, frontline staff, work colleagues working in NHS, local authorities, care homes, who want to do things and recognise colleagues who have passed away. And there've been lots of tributes online about how individuals, every day, when you see someone's name trend on Twitter, often it refers to someone that's worked on the front line who has died. I think what really hit me was that case of the Ghanaian nurse from Luton, who 28 years old, pregnant, but luckily they were able to have the baby born, and the outpour from the media around that was amazing. We know that the Muslim Council of Great Britain, they've been raising issues about the loss of Muslim clinicians as well. All communities, all BAME communities are affected by this, and the fund itself is trying to raise money from the community, from ourselves, that we can do stuff as well. And also at a time, as Yvonne said about the therapeutic side, that needs to be done. I was on a conference call just before this call, the All-Party Committee on Mental Health, and I raised a question about what is the NHS going to do to recognise culturally appropriate services around mental health, basically. One of the big issues is I know so many counsellors and therapists, they can't even get a gig working in the NHS. And the types of counselling models around IAPT and CBT does not meet our needs. This is a game changer. COVID-19 means that we need to change how we deliver mental health services in Britain for us, and we need to be that driving seat ourselves too.
Thank you very much. Thank you very much, Patrick. As I said, we're going to go to short rest. And when we come back, we'll have our, sorry, I'm hearing my voice come back to me now. I don't know why, the technology is going crazy again, but we'll be back after a 5-minute comfort break. Thanks very much. And welcome back to our final session for tonight. It's been a long night, but it's been so interesting. And I know that there's been lots and lots of chat going on in the chat room, and every so often I'm able to kind of glimpse with the corner of my eye, and people keep on texting me and saying, Michael, there are some really interesting questions coming. And I know that there are, and we're going to have to think perhaps next time we do this, should we do it again, about how we make better use of those questions and better use of those comments. And so they're not lost, because we are saving them, and we maybe should be publishing some of that. When we kind of publish the report on tonight, we should include some of the really interesting things that people have been saying online. And so keep them coming. I'm sorry I'm not getting to them as much as we thought we'd be able to, but let's go on. I am waiting now to speak with Ifoma. Ifoma, are you there? Ife, are you there?
Hi.
Hi.
I'm here. How are you, Michael?
I'm good. Could you speak closer to your microphone?
Sure. I don't know if this is, let me
Oh, that's a bit better.
Is that better?
That's better, yes, yes. And so you're joining us all the way from the United States of America?
I am. I am. First, I want to just thank Ubele for inviting me, and specifically Patrick Vernon, who I've worked with in the past as it relates to mental health. And while I'm here as an invited guest, I wish I could show you all the pieces of paper I've been writing on, because you all have provided some really amazing insights for us here, as we're also tackling a lot of the same issues here. So many of the things I will share will not be new. But I think as Patrick and I were speaking, one of the goals hopefully is also how we discuss communities of color, the diaspora on a global level, and how we find ways to increase the way we organize and strategize to hold especially governments accountable for what's happening. So I just as an introduction, I'm an attorney, I'm a researcher, and I'm a founder of a social impact firm called Pink Cornrows. And we have a project called Black Policy Lab that brings together experts and community to find solutions to our communities, recognizing that at times we hold certain positions and stature in more elite esteem than the people that have the actual information that we need, which are often impacted communities. So with the brief moment that I have, because I only have about 5 minutes, and this is respectfully
about 2 now.
Oh wow, okay.
No, go for it.
I wanted to I want to challenge us as to how we look at data. There's been a lot of conversation around data, and I want to proffer that data is not data alone is not going to save us. Before coronavirus, here, at least in the United States, 20.8% of African Americans lived in poverty. 17% of Latinx communities lived in poverty. 23.7% of Native American communities lived in poverty. And when you compound disability on top of that, in comparison to the white poverty rate, which is at 8.1%, we can already see that the baseline of how we evaluate what has happened to our communities, as has been raised by other panelists, has to start with the systemic embedded racism and also the other ways that ableism and sexism play into our systems. I also want to just quickly note that we often talk about communities in mostly a racial and ethnic lens. I want to specifically highlight that when it comes to gender that the intersection between gender and race is extremely stark. 52% of all essential workers are women, 9 out of 10 nurses are women, 2/3 of all of our grocery store workers and fast food workers are women. And the CDC here, our Center for Disease Control, has found that women account for 73% of US healthcare workers who have been infected since the outbreak. So I do think we miss an opportunity if we don't talk about how being both Black and a woman, being Asian American and a woman, being brown and a woman, and also going back to your home and what that means for your community, your family, and the overexposure that your community members may have because you have to work and you don't have the luxury of staying at home, which in some ways we have to also talk about how language isolates individuals that are housing insecure, those who are dealing with abusive situations, and those that are homeless. And so the final note is that because we had a short amount of time, we conducted a study called COVID While Black. We wanted to ensure that the narrative was not just about the statistics that are impacting communities of color, that people were able to create voice and match voice and narrative to the statistics that we're hearing about. And some of the top line policy solutions have also already been raised. How do we deal with mental health? How do we deal with reparations for essential workers as we go through this epidemic? I know we've been talking about post-COVID, but it's still up in the air if there will be a post-COVID. So we have to talk about what does it mean to restore families now. And another area has to do with education. A lot of kids are out of school right now, and there's a lot of concern as to what it means for those who were seeing higher education or going to college as the next step. What are they able to do at this point? But also our youngsters who live in spaces where they don't have internet, or they're not able to have conversations like this, but they are still held to the same standard of providing classwork and assignments. There's a whole range of inequities that were impacting our communities before, and we are excited to continue this conversation about how we can use surveys and the solutions that come home ground from our communities to address this issue. One final note, I will say that there have been a range of resistance movements that have been just as effective as many of the grassroots organizations you all have raised. There's an organization called Resist the Rona that is really working on making sure we still remain social, even if we're physically distanced. There are individuals that have provided mutual aid efforts, and there are people right now putting money into other people's accounts just so they can eat. So I do also want to make sure that we highlight that our communities are stepping in the gap. It is not enough, but we need to make sure that that's part of the narrative, because at some point the government should ensure that they are restoring our communities, especially for those that have stepped up in this epidemic. So
thank you very much. If we have an amazing group of young people who we're going to meet later on, who have been responsible for creating this event. I'm thinking as I'm listening to you, I would like you to be in contact with that group of young people.
Absolutely.
I'd like you to put them in contact with young people in the United States, and to see how we can stop the Atlantic being a border of people of color when we have this issue that we should be fighting together. And so that group of young people, at least one of them will be in contact with you in the very near future to look at how we start bridging that water.
Thank you, Michael.
Sabjit Ganga, have I said your name right, Sabjit? You need to turn your microphone on.
Muted myself. Yes, you did, Sabjit.
Yes, I did. Thanks, Sabjit. Because as I listened to Ife, I was thinking, I wrote something last week, I think it was, maybe the week before, about COVID-19. And one of the things that I kind of likened it to was going to war, and that when we went to war, we always set the poor and the Black working class whites out to kind of die first. And one of the things that it struck me when I read the piece that I wrote afterwards was this is different actually, because as Ife said, we have women actually on the front line in this one, and we have women who are dying on this one. Tell us about, can you talk a bit about that?
Yeah, maybe I'll just start by saying, like many women's, or like many voluntary and community organizations, the Asian Women's Resource Centre came together because mainstream organizations weren't meeting the needs. In this case, it was women, Asian women, and women who experience domestic violence. It was our organisation was set up in 1980, and we're based in the London Borough of Brent in Harlesden. Actually, I was looking at the statistics as on my phone as people were talking. Brent actually has 1,063 COVID cases, which is the highest in the whole of London. And obviously, it's the second most diverse borough. So that was quite interesting, given what the previous speakers were saying. So we came together to provide sort of specialist services, and we describe our organisation as by and for. So we're a group of women of colour, and basically we provide services to women who experience domestic abuse, which includes forced marriage, honour-based violence, FGM, and also some of the lesser known harmful practices such as, you know, breast flattening, widow rape, menstrual health. But I think that, you know, for us, and I think that in accordance to the government guidelines, the self-isolation and household isolation and domestic abuse is a deadly combination. If you think about the way power and control, coercive control operate, then you'll know that women actually are not able to actually access any support that they need at this time, because their moves are watched, there's under surveillance 24 hours a day. So our focus really has been around trying to make sure that we are continuing to provide services to women. And I just want to say that, you know, the BME sector have been providing services for women before the pandemic. We're providing reshaped services during the pandemic, and actually post-COVID pandemic, which I also want to talk about, and some of the support needs, is that we are going to see a tsunami of cases that are coming and actually knocking on the doors of BME organisations that are providing specialist services. So, I mean, we know that our organisations from April onwards, we saw from the April the 1st to the end of April, we saw 35 cases. And we know that the Women's Helpline, the Women's Aid Helpline have had calls doubled actually to people calling them up for support. And obviously it's really vital that those services that are kind of remain. I think also I want to say that, you know, in the midst of pandemics, we know that inequalities actually exacerbate, you know, and I think that these are some of the messages that we need to be telling funders, commissioners. And actually, I think also I want to say that we need to work across sector. Now, I work across the women's sector. I think the homelessness sectors, the women's sectors, the BME sectors, we need to come together to be that voice of the communities that we serve, to make sure that those people in power actually hear them. And I want to give you one really little example. We work with women who experience no recourse to public funds, and colleagues have talked about that, so I don't want to talk about that too long. But this is an area where the government has never provided support to women. So you're stuck. If you come into the country, you're married to a British national, you're relying on him to actually regularize your stay or your immigration status. So this is a fight that BME communities have been fighting, you know, before the pandemic. But I think that what we also need to be saying, I think, and our experience is this, some of the larger organizations that are coming in, sweeping in to be kind of experts around BME organizations and actually ticking the box that they provide BME services. I think we need to be a bit courageous. I think we did through the women's sector, we said to the large organizations, hands off. This is not, you don't know about this work. We know about this work. We can deliver this work. And I think we need to display some sort of leadership around that. So I just really wanted to say those couple of things.
Thanks very much, Sabji. Charlie, how are you?
Hi, I'm good, thank you.
So Charlie, Sabji has started kind of almost mapping out and beginning to talk about that kind of intersectionality of need. And so it's not enough to just say we've got to resource the Black and ethnic minority community, but we've got to look at how that breaks down as well, and to make sure that our women are protected. I'm going to talk to Leroy Logan in a moment about policing and making sure that our young people are protected. Tell me about your organisation. Tell me about what you're doing and about how you're dealing with that need.
Absolutely. So I'm speaking on behalf of GALDEM, which is a new media publication which is committed to telling the stories of women and non-binary people of colour. And the aim is sort of to address inequality and misrepresentation within the media industry, which, as we know, is rife. One of the main reasons that GALDEM was set up is because there are stats from 2016 which suggest that the journalism industry is 94% white and 55% male. But beyond that, you know, you can go into pretty much any newsroom, any media organization in the country, and you just look around and you don't really see people who look like us there, unfortunately. This means that, especially during times like this, GALDEM and other publications like it, such as Black Ballads, such as The Voice, any publications which specifically focus on BAME communities, are even more important. Although we have seen an increase, thankfully, in reporting around our communities, I think, from some of the mainstream like press organizations, the BBC, The Guardian, Independent, are all doing good work. We are the only people, you know, as we've been speaking throughout this whole sort of conversation, we the people who need to be leading these conversations. No one but us can be like telling our own stories accurately, sensitively, and with intersectionality in mind, as you touched upon before. What we want to do at GALDEM is always uplift the most marginalized voices. We're thinking about people who are in immigration detention right now. We're thinking about people of colour who are also queer or who are also homeless, who sit on the intersections of lots of different problems. So yes, the media needs to be held accountable, as well as the government, and we need to make sure that they are reporting on the issues that they should when it comes to
one of the most powerful things I think I've seen hit my WhatsApp page, and loads of stuff is coming in from WhatsApp. I think everybody's got really bored and have started to make TikTok videos. But the Gina Yashere video, where she brought it home to a lot of people, actually, that hang on, that people of colour are on the front line. And every time you see the wonderful nurses or the wonderful doctors on News at 10 or at Thames News, they would never show BAME people on the front line. And so I can see the real need for us to have our own narrative, to speak our own voice, to show our own pictures.
Absolutely, it's so important. We just published an article today about BAME key workers. As I'm sure many of you guys know, we make up a huge amount of healthcare workers in this country, and it's really a disgrace that up until Gina, who is a commentator and a comedian, pointed it out, that wasn't really being addressed by the mainstream media. But it really is as simple as the fact that, like, a lot of these organizations are ran, are made up of people who really don't see us. They don't see us, they don't care about us. And yeah, we need to be supporting, organizations like GALDEM. We're small, but we're mighty. And we can change the conversation, and we can bring the faces, the voices of people of color who work within healthcare, who are key workers, who are just suffering from the effects of
something. It seems that Charlie's technology has let her down. But let me take this opportunity to bring Leroy Logan in. Hello, Leroy.
Hey, hi, how are you?
I'm good, how are you?
I'm just absorbing all of this, and yeah, it's been fascinating.
Right, okay, so Leroy Logan, you were one of the first Black policemen in the United Kingdom.
No, I wasn't one of the first, but I was one of the founder members of the Black Police Association. So we were like the starting of the critical mass of Black officers who were speaking up for themselves from within the organization. And of course, myself and a couple of other members of the Black Police Association gave evidence to the Macpherson inquiry in '98, and the recommendations of '99 saw that we talked truth to power. And I think it was one of your earlier speakers, Jamie Shearer from the church, she was talking about Macpherson, and learning from that, I think, has to be front and center in what we want to do as a critical mass of people who need to be talking in a way that there's an internal lens within the health service or the care services, because unless you have that internal lens, you're not going to be able to hold certain people to account as you'd like to. So, you know, I would like to think the learning from Macpherson could be really important, what we want to do with this whole review that's going to be looking at COVID-19.
Leroy, as one of the outcomes of this pandemic has been that the state has increased its powers to control the way that we live, to control where we move, how we move, what groups we can be in. It's extended its powers for stop and search. And we know about the problems that stop and search just caused our community in the past. Do you fear, Leroy, that those powers might also be used on the Black community differently to the way it's used on other communities?
Well, I can't discount the possibility that might occur, because even if you look at history, most powers that were given, even the temporary powers under counterterrorism, invariably the Met and other police services around the country didn't want to give them back. So they tried all sorts of ways of holding on to those powers. So again, that internal group like us in the BPA called them out on how they would work with those powers. And as a result of that, sometimes we had to go to the police authority, the Met Police Authority, and we had our own internal inquiry. And as a result of that, the Lord Morris inquiry, when we asked Bill Morris to do some work for us, just to bring back the control to the accountability and transparency that is essential. So I wouldn't be surprised that they'll try and keep hold of these powers. So far, in terms of the coronavirus legislation, there hasn't been a disproportionality in the Met. Now, I don't want to be London-centric, but the police services that seem to be really overzealous with their powers is like Humberside and Northern Forces. But the Met, surprisingly, have been very quiet so far. I would like to think it's because they know they're going to be scrutinized. But if you look at the whole artificial intelligence, the automatic number plate recognition, facial recognition, the whole algorithmic policing, or the calculation of suspects, how they're going to operate, we're starting to see institutional racism by algorithm. So that's my real concern. And the gangs matrix that has been used disproportionately, and as a result of working with Stopwatch, the Information Commission, and even certain other Youth Violence Commission that I was part of, we got the mayor to review it, and that matrix has been drastically controlled more than it was, because the Met was just keeping ahead of the legislation and taking advantage of loopholes.
So if you had to say one thing, Leroy, that you would like to see our community doing, or one thing that you would like to see done for our community right now that will make a difference, what would that thing be?
Well, I think, we definitely need to be collaborative, and I really welcome this event. But I think the key part of it is how we talk truth to power. And I was speaking to one of the most eminent consultants today, and I won't mention his name, but I was asking about, you know, what is it like in the health service and what is the issues? And I would like to see a collaboration of the staff associations in the health services, speaking with organizations like Ubele and the various partners to come together to ensure that the data analysis is actually making sense from that cultural competence point of view. Because I know a lot of reviews in the past don't have that cultural intelligence to really do the proper assessment around the vulnerable group, which is us in this case. And of course, what are the control factors to make sure it doesn't happen again? And having done work with the Windrush, in fact, my earlier Zoom meeting was with the Windrush Action Group, which Patrick Vernon is a part of. And it's really starting to say, listen, we've got to own the data internally in the health service, as well as externally with us, coordinated in a way that really, they cannot answer it. Just like with McPherson, when we gave evidence from within the police, they couldn't say, oh, it's rubbish. We told them straight as it is. And that's the importance here. Really empowering our brothers and sisters within the healthcare and the social care services to come together, empower themselves, and let's work with them to start talking truth to power. And lastly, with our young people, and that's why I'm really proud to be the chair of Voyage, hence name check in the shirt, and my CEO, Paul Anderson, who's in the audience and sending me crib notes and everything. We are a resource to help with that. And, you know, especially with our young people and the importance of them knowing that we're acting on this, because I think I wouldn't want that this happens and our young people said, well, what were you doing? Were you conspicuous by absence? So that for me, get that collaboration right and make sure it's youth focused.
Thank you very much, Leroy. And just kind of moving from there, because we're running behind. We thought we would, but we thought we'd only be 10 minutes behind. We're actually 24 minutes behind. And so we're going to bring tonight to an end. But I would like, before we end, for all of the young people who have been involved in organising tonight to switch their cameras on. And so I'd like all of the young people who have been involved in organising tonight to switch their cameras on. Hey, hello, Saffron. So Saffron, you're the first of the brave. Can I have all of the young people who have been involved in organising tonight to switch their camera on, please? Hey, oh wow. Hello, Mr. Thomas.
Evening.
Hello, Aisha. Hello, Eve. Who am I missing? Where is Sam? Hello, Anita. Where is Sam? Where is Kelsey? Okay. Thanks, Sabjid. Thank you very much. You can flick your switch now. Okay. I'd like to thank you for the incredible job that you've done in making today happen. And I'd like for some of you, any of you, to tell me about why it is that you thought it was so important to do.
Okay, I'll start. I guess for me, growing up, I thought racism was something that was like segregation and angry words and something that was shocking and violent. And as I'm getting older and I'm learning and I'm unlearning, I'm realizing that it's invisible, that it's systematic. And Carly mentioned when she was on the panel earlier, it's up to us to tell our own story. Yeah.
Okay. Thanks. Eve? Why did you think it was important to get involved?
Hi, can you hear me?
Mm-hmm.
I think it's important just because.
Night, darling.
Night, darling. Hello. I think I just wanted to be a part of a group of young people who genuinely just want to make a better contribution to our community and society in general. And I feel really privileged and honoured to have helped in the very little contribution that I gave just to help bring this event together. And thank you so much for everyone who supported us online by retweeting, sharing and signing the petition. Just, it's really great to see such our community just come together in such a short space of time.
Otis, do you want to tell us something about the petition that Eve just mentioned?
Yeah, I think it was important that we created this petition just so we could collect the data and see how important it is to everyone, and then move forward and hopefully get the numbers required to make it official and get the answers that we're demanding. So yeah, I'm happy to be part of the campaign. Obviously, anything Ubele is involved in, and get the call and I'm on board. The answer's always yes. So much appreciated for having me involved, and yeah, anything else, I'm on board.
Thanks very much. Aisha?
I think it was just important. We just really need to hear, as Saffron and Charlie mentioned earlier, we need to be able to tell our stories. We need to raise awareness of what is happening in our communities. And the only ones that are actually going to do that is us. So that's why I think it's really important to have these conversations and to be a part of, not even to be a part of it, we need to be the people taking the step to make the change. Sadly, we do, due to systematic racism and other things that our communities face. So I think conversations such as these, the calls to actions that Ubele, Ubele is sort of asking, are just really, really important.
Thank you very much. Sam?
I think echoing what the others have said, I think I've got to a point where I'm fed up of seeing, our communities suffer in this way, particularly when we make such a huge contribution to society, in terms of healthcare workers, bus drivers and so on. And we're seeing that now because there's a huge proportion of key workers that are from kind of the BAME communities. And I'm really glad that Ubele has raised this. I haven't, this is a really energetic kind of team of people, really focused. And I think someone had to kind of organize an event like this and issue a call for action. And I think that's important to hold the government to account, plus, other organizations that can help our community. And finally, I think we need change. We can't come out of this crisis after what we've seen happen, after seeing people's parents pass, their daughters, their mothers, and so on. From, I think, things that were basically because of things that were completely preventable in terms of PPE or even knowing their rights as workers and so on. And I think we need real change after this, otherwise we would have failed as a society. We need societal, structural change.
Thank you. Kelsey?
Hey, sorry, I have so many devices on. I can't seem to keep track. Can you hear me okay?
Yeah, we can.
So I think for me, why I want to get involved, kind of to echo what everyone else is saying, it's the pandemic is real. And I think in all the bits of work that I do and that I do with so many people in this group, it's important that we ourselves are kind of shaping a narrative. For me, as a young person, as a Black person, as a queer person, to kind of keep trying to hold on to some of the narrative and really see where we can influence change. So yeah, that's me really.
Thank you, Kelsey. And finally, Rihanna.
I think it's been an amazing experience to be a part of a team of really committed people.
people who are passionate, they all have something to contribute. We've seen in the past that there's been so many reviews that highlight institutional racism as being a key factor in disparities, but there's no actual practical steps that we see that the government is saying this needs to happen or that needs to happen. I think hopefully with this inquiry, we can get some real practical solutions that can be implemented and therefore allow people to not just survive, but thrive long term. It's been amazing work of this team, and I think it's just the beginning of something really special, really powerful, and really purposeful. And I'm thankful to the Ubele network for allowing us to come together as young leaders and kind of, I guess, contribute in our own little way. And most importantly, just allowing us to lead. It's been an amazing experience, really powerful, and I'm thankful for the opportunity to be a part of the collective.
Okay, and Anita, you're the Ubele comms worker. And so you're kind of responsible for all of our communications, and you've been ripping your hair out and working with this group and kind of doing all that it takes to make this event happen. What was it like for you working with this group?
Oh my gosh. I feel so privileged actually to be part of the Ubele. And to be fair, like the fact that we've started to organize it a week ago and the amount of energy and work put into this event was absolutely incredible. So I feel like the Ubele brings in people and basically everyone feels like a member of a family. So I feel so happy that everyone who joined us, yeah, could make this happen. I mean, we wouldn't be here without you.
Okay, thank you all very much. And you know, I think the job that you have done in the past 8 or 9 days has been incredible. Yeah, that we are aiming to continue to work together to get 100,000 signatures on our petition so that we can force the government to debate the need for an independent public inquiry into COVID-19 and the Black and ethnic minority communities. If we were anywhere, if we were in a theatre, if we would ask people to applaud you as we left, as we're not, what I'm going to do is I'm going to ask you to just quickly applaud each other and say good night to everybody. Thank you very, very much for tuning in.
Good night, everyone.
Thank you very, very much, everybody, for watching. Thanks for being part of it. Please keep your comments coming in. Any thoughts you have, email us info@ubele.org. Thanks very much for staying with us tonight, and good night.
Good night.
Bye.
Bye. Bye.